Here's a question that I get a lot regarding hospice care, and it is, does hospice cover round-the-clock care? Good question. Stay tuned. Let's take a look and let's answer it together. So, does hospice cover round-the-clock care? Yes, and no, and it depends. I know that's not really the answer that you were actually looking for, but it does and it doesn't sometimes. And so let's look at hospice as a building, right? And in that building, it's got several different levels. The building itself is hospice, right? On the first floor, you've got the first floor, which is routine care. They call it routine care, which is daily care. Then you've got the second floor, which is kind of like a little bit higher care, a different level. And that specific level is continuous care. So now if you go above to another care, you've got respite care. And then above that is GIP care. These are all different levels within hospice care. And so I want to walk you guys through that real quickly and break down what are the different areas and different ways that you or your loved one can receive hospice care. And within those levels, there are parts that are round-the-clock care and there are parts that are not round-the-clock care. So let's talk about it real quick. So routine care, let's talk with the first floor. Now these floors, they kind of differentiate, right? It could be routine, it could be continuous care, it could be respite, it could be general inpatient. Either way, let's just talk about the first floor, which is routine care. So routine care is basically the care that actually gets you started into hospice care. You've got to meet that criteria. A terminal diagnosis that's given by the doctor, or 6 months or less to live. And so really now that initiates you into regular routine care. So that could be a nurse that's coming in once or twice a week, not round the clock. It's just to kind of see how you're doing and how the family's doing and how the patient's doing, monitoring pain levels and symptoms and how they're doing and how they're progressing or declining. Then you've got an aide that can come out, and that depends on the need of the patient. Some people don't want a bath. You know, some people, they need a bath because the family needs help to help them get bathing. So that could come anywhere between 1, 2 times, 3 times, sometimes at the max 5 times a week. Then you've got a social worker that comes out, and that frequency is usually established by the patient and the family on how much that they need the social worker to come out. And you've got a chaplain for spiritual coordination, and they can come out weekly, they can come out once a month. It just depends on the need. And then you've got also the doctor that sometimes may come out, but not frequently, but usually coordinates with the RA and case manager and lets them know what's going on. So those are the people that really kind of come in. You've got a volunteer coordinator sometimes. Sometimes families are like, no, I don't need a volunteer coordinator, I'm good. But those are the people that are actually make up the team that is routine care. So they're constantly coming in. They're not round the clock, but it's just normal care. And so they really kind of walk you through that path. And that's like the first step. That is routine care. Now let's talk about the second level. The second level is continuous care. So now you've got the regular routine care that we talked about, and now you've got continuous care. So continuous care is actually someone is there almost at the bedside almost every hour. And this is usually to maintain pain and control symptoms and make sure that the patient is okay and they're doing all right. It could be, there's several different criteria, right? And the nurse usually goes out and assesses whether or not they meet those criteria because Medicare has a list of criteria that states, okay, this actually warrants continuous care. And not every patient, not every situation warrants it, but it's the discretion of that hospice to interpret what the needs are and coordinate with the doctor that's overseeing the care of that hospice patient and make sure they say, yeah, okay, actually, this patient actually needs continuous care. So in that case, it's usually round the clock care. It could be an aide that's coming in. It has to be a skilled LVN that's there for a portion of that day, but it's 24 hours. And then usually the nurse comes back and assesses and reevaluates every day. Is that need still there to continue? Because what's happening is now Medicare is sending all of those funds to the agency to help them to monitor and see how what the needs are. Is there more medication that's needed? Is there more DME equipment? And that's reassessed daily by an RN going out there and checking out and seeing what's going on. So that's the continuous care that's usually in the home, right? And so usually the nurse comes out, the aide comes out, right? But there's someone there that's always at the bedside. And that's monitored by the team, the IDD team. And as mentioned before, the nurse comes out once a day. Also, on top of that, someone sitting at the bedside to reevaluate to make sure, is that person or that patient still meet the criteria for that continuous care? That's that level. That's that second level. You have the first one, routine. Second one, continuous care. All right, now we're taking our elevator. Now we're going up to the third floor. Third floor is respite care. So respite care is kind of like it sounds. It's respite care, right? So rest. So this is all within the building of hospice care, right? So the building is not an actual place. It's just an example that I gave, right? But think about it this way. Now that you have within that level, the third floor is respite care, right? So now respite care, think of it as a place where the patient can actually go and then the caregivers can get relief. They get rest, right? So say, for instance, your loved one meets that criteria and says, okay, hey, the hospice can say, hey, we work with a facility and they can stay there for about 5 days and we'll take care of them and you get a rest. So it's like a little vacation. It's a weird way to say it, but it's a little rest, right? So the family members can take a break knowing that, okay, the patient is not there in the home anymore. They're in their facility. The hospice is in charge of making sure and coordinating with that facility that everything follows the regular plan of care that's supposed to be abiding by the doctor and what they recommend, right? And so now the patient's over there and now you get a rest. And so that's within, and usually it's about 5 days. It could be sometimes shorter, but it's usually 5 days. So now you get a rest. The family gets to rest, and it's about a 5-day stay, right? So making sure that you get to take some time to yourself as a loved one, but the family is actually away from the patient, right? And the patient's getting services outside temporarily, not permanently, but temporarily at a facility. So let's talk about the fourth level. The fourth level is general inpatient, which is also known as GIP. So general inpatient is basically the hospice contracts with a skilled nursing facility or a hospital floor. There has to be an RN there 24/7. So the hospice contracts with that place. And if the patient's at home or coming from a hospital and they have uncontrolled symptoms, they could have a lot of pain that can't be controlled at home. There's maybe like uncontrolled bleeding, it could be vomiting, it could be a whole bunch of things, but it's not being able to be controlled in the comfort of the home. So now the hospice contracts with a facility and they stay there, right, until they can get their symptoms controlled, right? And so that's different than respite, because respite is not about symptom management, it's actually rest, right? But when it gets to the point where those things cannot be controlled at home, then now the hospice contracts with a facility and the hospice coordinates with that facility and goes there and touches base and makes sure everything is okay with the patient. And so that's like the highest level of care outside of the home, but it's not permanent either, right? It's meant to be there until the patient's symptoms can be controlled, right? And Medicare states that there's certain specific criteria. And now all of these levels have to be met by certain criteria. So you got the same building, you've got routine, you've got respite and continuous care, and then you've got GIP. All those are specific criteria that before you can go to the next level, the hospice evaluates and makes sure that, okay, hey, that we're good. Okay, now we're going to this level. And that higher level means higher care. So now to answer the question, let's go back to the main question does hospice cover round the clock care? It does and it doesn't, based on those levels, right? And so when you think of hospice, or someone saying, hey, I need hospice, or someone, your loved one, needs hospice. Now we're in Texas, right? So there's different regulations for different states. So also, but we're coming at it from specifically Texas, and this is 2022, so just so you guys know. But specifically, you're looking at overall, when you're looking at hospice care, there's different levels, there's different criteria that have to be met. And within that criteria, you can get round the clock care if that criteria is met. And so a lot of times we get calls, and I'm sure doctors' offices get conversations that say, if a patient needs hospice, and in your mind, it's like someone's gonna be there all the time. That's not true, right? And so it's a benefit of Medicare, right? So it's something that Medicare dishes out payment and reimbursement to the hospice to supply all those needs. And when they warrant the round-the-clock care, then they get round-the-clock care. Then you and your loved one get round-the-clock care. But when they don't, it goes back down to the routine care, which is every so often, right? And so it really is one of the things that we've seen in our experience is that the best hospice scenarios, are the ones that have a family around them or friends around them that are helping through this process, right? And so it's just like when you have a baby and you're so excited, right? And you've got friends and loved ones who are giving you money that you haven't even never seen before, baby shower gifts. It's the same process with death. The good experiences are the ones that have loved ones around them trying to figure out and help out and do what they can do, because Medicare is not supposed to cover everything, right? It's not possible, right? It's a benefit. And so that benefit is for that individual. And so it's basically the job of the family, of the loved ones, of friends to come alongside that patient and help them through the process. And really you have hospice as an extra help, as a benefit through this process. So I hope that helps you guys. I hope that clarifies some things. Healthcare is a little bit crazy sometimes, but I hope this helps to kind of clarify it for you guys. And if you have any questions, feel free to send our office an email or call us. Our office is 972-424-3200. Feel free to reach out if you have any questions. We're here in Dallas, and we'd love to just educate at times as well. So God bless. Boom. See you.